Hello, my name is Steve Allen. I'm with the North American Institute of Orthopedic Manual Therapy, here to talk about and demonstrate assessment of the ankle ligaments. As an introduction, I want to talk about discrete testing versus a scan of the acute injured ankle. So in the acute injury, we would be doing remote testing and not selective stability testing on the individual ligaments of the ankle and foot. So that would be more of the screening with hands well away from the ankle joint itself to minimize the force and the potential for further harm on stability testing. So in the acute presentation, we would be looking at the ankle and foot in that position. But for the purposes of this lab, what I would like to do is actually demonstrate stability testing on the individual collateral ligaments of the ankle and the bifurcate ligament. Okay, so let's have a look at stress testing a few ligaments around the ankle joint. So the most common injury is an inversion sprain leading to disruption of the anterior talofibular ligament from the anterior distal surface of the fib onto the talus. Fairly short, somewhat broad ligament, easily torn with, of course, an inversion sprain leading ultimately to anterior lateral rotatory instability. Remember now, on stability testing ligaments, there's 3 steps. One is I'm going to take up the physiologic movement. 2, I'm going to take up any accessory play. And 3, I'm going to do something very non-physiologic, try and separate joint surfaces. And of course, if that infill is lax, that would be a positive sign. So I come in on the distal fib and I get as close in on the talus, leads to a V in my fingers. So the positive, if we walk through this, there's physiologic, there's a little accessory play, and then holding my left hand stable, literally try and separate joint surfaces. So if my V opens, that would be a positive sign. I want you to remember this position when we do the anterior deltoid. It's going to be significantly wider because it's a much wider ligament.